Why are we all of a sudden seeing a significant rise in the number of cases of brain abscesses in kids? Yesterday, in a presentation by the South Nevada Health District, they stated that they have had triple the amount of cases in life-threatening brain abscesses in kids in 2022. Let's break down the facts of what we know about this scary trend. Brain abscesses are not something that neurosurgeons have to report to the CDC. However, one neurosurgeon that takes care of pediatric patients in the state of Nevada has noticed that she typically averages seeing about 4 patients per year. But in 2022, there were 18 cases of this. That's a significant rise in the number of cases. She brought this up to the attention of the CDC, and it was announced that other hospitals are seeing the same trend. So what is a brain abscess? It's a pus pocket in the brain, and it requires surgery and sometimes several surgeries to get rid of, as well as long-term antibiotics. Sometimes these kids have to spend weeks to months in the hospital. Here's an example of what a brain abscess looks like on imaging, and surgeons have to go in there and clean out all that infectious material. Symptoms of brain abscess include headaches, altered mental status, and fevers, as well as potentially neurological deficits like weakness, numbness, or seizures. The most common pathogens are staph and streptococcus, which naturally live in our nasal cavities. In kids, typically brain abscesses are the complication of a severe ear infection and/or a sinus infection. Having a respiratory virus or a common cold can predispose for kids to develop ear and/or sinus infections. If bacteria builds up in the ear or in the sinuses, it can actually spread to the brain and cause a brain abscess. So why do we think that all of a sudden these things are happening at increased frequency? Some experts have suggested a theory called immunity debt. During the pandemic, kids weren't exposed to as many viruses and bacteria due to masking. Maybe this trend is due to the surge of respiratory viruses since our kids have not been exposed to these. And our immune system has weakened during the pandemic, so our ability to fight off these infections have lessened. We haven't excluded the possibility that COVID itself may play a role into this. I'm interested to know what anybody else's thoughts are on this because I find it truly fascinating. Drop your thoughts in the comments section.